I know you must be sick of my voice by now, but what I want to talk about is my situation in life and the dysfunctions that I faced. So for 33 years of my life, I was addicted to drugs. My drug of habit was marijuana and alcohol, cigarettes and things like that. So I grew up in a very violent family. My father was a Māori battalion, so he came home with a lot of anger in himself, and he was not able to deal with those issues, and unfortunately they were passed down to me. So not only was I addicted to drugs, I was also a very violent person. But what was able to help me on my journey was learning about who I was. I grew up in my taha Māori, my Māori side, but I didn't know how to use it. You know, when I was out there using it, it was for the wrong things. So the first thing that happened for me was to learn about the Sky Father and Earth Mother. You're learning about their balance, and that gave me a different perception of what woman in my life meant to me, because those were the people I was very violent to, the women in my life. But learning about who I was culturally was able to set me up on a journey that I knew I needed to help myself in terms of well-being. So I presented to this program in 2016. My cholesterol level was 8.9. I was asthmatic. I had chronic bronchitis, as well as other things. So I was fortunate enough to be accepted onto this program. I graduated after 10 weeks, and at the end of the 10 weeks, my cholesterol level was down to 4.5. A year after I started the program, I do not use an asthma pump anymore, and that was due to giving up marijuana and giving up cigarettes, because I knew that I was on a journey, and if I was going to fool myself, I'm just going to go through life being ill, and not just physically but mentally as well. So this program was able to open up a lot of opportunities for myself. My partner, she told me at the start that I would never change. We've been together 25 years now, but for 17 of those years I was quite a monster towards her. But when I discovered about the balance between relationships, I started to turn my life around. But the one thing she thought I would never break was marijuana, because I had to do everything in my power to keep my next fix. So coming through this program, I decided my third weekend that I was going to make a good go of this program. So I think it was about 3 months after I finished the program, I went in and got myself tested for drugs, and I was clear. And that was January 26, 2016, and I haven't touched marijuana since then. 2017, June, I went in and I tried to quit smoking cigarettes. So this June this year, it'll be 2 years I'll be smoke free. So doing those interventions for myself has allowed me to breathe easier. If you look at that care plan, the Pātu Wata Wata, that's the plan that I devised for myself to help myself to stop quitting. But I encourage the men to use that plan if they will, for anything or any goal that they want to set for themselves. But I won't go into it. Everything that I planned around it is all written in there. But that's why I believe a lot of our kaupapa Māori models can work for us if we apply ourselves to them. And for myself, I'm been very fortunate that January 2018 I took over running this program, and I've just never looked back since then. And then we were able to hire Richard, and he'll tell you a similar journey that he's been on. But in terms of my partner, every graduation we have, she comes back and she does the cooking for our men, because she believes that much in this program. That's the only way she feels that she can give back to it. So thank you for your time. I have to rush through it because we've still got a few things to go through, but I think Richard's going to have a kōrero to use now.
Kia ora, Kiwi. Okay, so my story starts, or the part I'm going to talk about anyway, in September 20th, 2015. I had been released from Spring Hill Prison. It was my third time I'd been to prison. So I'd made some pretty dodgy choices in my life. That ended up that I had been in prison for quite a number of September 20th. I was lucky in the sense that while I was in Spring Hill Prison, I had been to see the psychiatrist there, and when I got out, I mean, the first thing I did was drunk myself silly. They give you what's called steps to freedom money, and I just drank myself silly for a couple of months and isolated myself. I didn't want to talk to anybody, but because I was under conditions, and the psychiatrist from the hospital, from the prison, suggested that I go to Te Ngāko, which is the mental health people in Rotorua, and they actually referred me onto the tāne Takituake program. I was quite reluctant to go because I was quite happy being isolated and getting drunk at that time, but I had to, so I went. But what I realised actually after a couple of weeks is that I was actually starting to get interested in it, and the other thing that happened too was that I was still proud enough not to get drunk the night before, because I didn't want to turn up overhung. So my drinking kind of eased off a bit. I started to take in what was going on, and I started to enjoy the company. So those are the first things that started changing in my head. My thinking started changing. I think the next thing that happened for me was actually I was lucky that my partner had stayed with me through all my time in jail. And what was happening, I was bringing back pamphlets and stuff like from the nutritionist and things like that about healthy eating, and she just saw these things on the table, and she was wondering what was going on and where I was going during the day and what was happening, and what the hell is this all about? And one thing that started happening is that we started to make a connection again, because we had grown apart. I mean, I was lucky she had stayed with me, but I'd started drinking immediately once I got back home, and I was an asshole, pretty much. I don't know why she stayed with me. I think I'm pretty lucky. But that's changed now. But she started noticing those things, and she started getting interested too, and then things started happening. We started talking about it. We started shopping together, which was kind of weird. We started eating healthy because just of what was going on, and we've got 3 mokos that we look after, three grandchildren, and so by proxy they had to start eating healthy too, and so that's that kind of explains a bit of how we like the program to go and for it to carry on to the whānau. So that started happening with me without me even noticing. I think the other thing that happened was instead of power bills and phone bills in the fruit bowl, there was fruit. Just little things started happening, and now my missus, she's a stalwart at the gym. Me, not so much, but no, she's got right into it now, and so she's seen the whole change in me. She's not scared of me anymore. The mokos haven't seen me drunk. They sit on my knee and I read them stories now, and that makes me feel good. I never used to be that person. Not only that, I think when the program finished, I realized I had to do something different, because what I'd been doing in the past wasn't working, obviously. So I went out to study. I did a bit of study. I studied Māori health and mental health and addictions, and that was a struggle because I wasn't used to getting so little money, and having to go and get emergency food grants from WINS and all that kind of stuff. But I stuck it out, and then finally I was lucky enough that Korowai Aroha actually offered me the position to work with Kiwi on the tāne program, and I'd applied for heaps of jobs, but because of my criminal record, everyone just looked at that and pretty much threw it away. I was just lucky that the environment, the place, the CEO at Korowai Aroha saw my background as an advantage and not as a detriment, because it meant that could relate to a lot of these guys who are coming on the program, and so she looked at it that way and gave me a job. So I just feel really lucky. It's a really rewarding job, as I said, not monetary wise, but when you hear the guys tell their stories at the end of it and how they've changed, and you might have had that little bit in helping them change, then there's no better feeling than that. But so that's pretty much how the tāne program, that's what it's done for me. Who would have thought 5 years ago, straight out of prison, and I'd be talking in front of a group of people in Wellington about health. Well, not me. So as well as being a paewhiriwhiri or a facilitator on the Tāne Takituaki program, my other role at Korowaiaroha Health Centre is to get our clients to come in and do their CVRAs, or as Tim just said, their heart health checks done. Now it's probably, have we mentioned earlier, probably that we deal with what could be described as the hard to get patients in Rotorua. Our catchment includes Ford Block, and for those of you in the know, that was the setting for Alan Duff's Once Were Warriors movie. But I prefer to call it by its Māori name, which is Manga Kākahi. And because of the structure and establishment of Korowaiaroha, we also serve a number of the other low-income areas in Rotorua. So now it's generally regarded that the people who live in these areas are somewhat ambivalent or even quite callous in their attitude towards healthcare. And then, so that's, so it set up a pretty difficult task for me. In fact, if I'd known what I was getting myself into, I probably wouldn't have taken on the role. However, ignorance, straight in there, However, our boss wanted to be more proactive about getting these people in to get their preventative health checks done, and to try and get some more equitable outcomes for Māori. So the wero was put to me to go out there and get it done. So previous to taking on this role, the process was to, I think it was to send a letter, then a text, and then maybe if that didn't work, maybe try and call the people on the phone. It was obvious that this approach wasn't working. Otherwise they wouldn't have asked me to take on the CVRA role. Now, I think it was an advantage for me that I didn't even know what the process was before they asked me to do this, because that meant I came into it with no preconceived notions about what I should do. I was just told to go out and get them to come in, and that was all. Yeah, good one. So, at first there was a bit of trial and error stuff, and I didn't know what to do really. And as time went on, I just started to refine the system, and I look back on it now, and it's become evident that there were three things that contributed to the success that I'm now having in getting these people, and when I say these people, I'm referring to mainly our Māori low-income clients, to engage with our healthcare system. Now, the first of these I've heard mentioned a couple of times already is engagement. The second is equality, and the third is education. So there's the 3 E's. Now, for me, really, it's not rocket science. It's really what it is what I'm talking about is understanding the people that you're dealing with. So firstly, I'll deal with my whakaaro on engagement, and that's all about building relationships. And the only way you can build a relationship with a client is over time. One of the first things I found is that you have to get out into the community. So relating it back to my mahi, my first course of action was to go out and visit people. So I quite often do get a negative, or at best a reserved reception when I show up at the door. At worst, I've had a wheel brace thrown through a window at me. and I've become an expert in leaping fences to get away from dogs. Yeah, I think you've never seen a fat Māori boy run so fast or jump so high, and then when you got a big bull mastiff disputing territory with you. You know, I've been told to F off. Gives me a bit of an understanding of how the Jehovah's Witness people feel. They do their door knocking thing. I think, you know, it's lucky for me metaphorically and literally that I've grown a thick skin. Anyway, what am I talking about? Oh yeah, that's right, CVRAs. So there's an innate suspicion amongst our people of authority and institutions, and that comes from a lot of things. Colonisation, dealings with police and WINS, you know, government institutions. Even if you've had a violent upbringing, you know, you have that, just any authority figures that you're suspicious of. So usually a letter or, you know, a text, you know, that just ain't going to cut it with most people. So as an example, I was told by one guy that he'd been given the opportunity to do a free hearing test. And his experience was that the free test was a ruse to get him into their practice, and once he got there, they tried to sell him some expensive hearing aids and, you know, stuff that he didn't think he needed. So, you know, for him, that was an experience that he thought, now that I was ringing him to come into the practice to get his CVRA done, that we were going to try and sell him, you know, something by stealth. So it took months of, you know, talking to this guy, and before he let his guard down and came in to do his test, you know, so sometimes it's realizing that our people have had a bad experience with health professionals in the past, and so I had to convince them that we weren't going to treat them that way. And I think one of the big advantages for me is that I've got brown skin and I'm pretty. Oh no, I'm pretty relaxed in my manner. Oh no, like the first version. I'm pretty relaxed in my manner. So that means, so I go to their house, which means I see them in their own environment, and they're the ones in a position of control. My modus operandi is usually to start off by trying to find some way of making a connection. And being brown, you know, you can use whanaungatanga, you try and find a common, you know, whānau connection, or even, you know, a friend or something like that. Sometimes I try and look on their bookshelves, you know, they might have cookbooks or something, see something they're interested in, just strike up a conversation about that. You know, you don't go there immediately and say, oh, I'm here to get you to come in and do a health test. You know, it's about what I said before, it's about building up a relationship. So, I mean, just recently there were a couple of guys in Rotorua I knew who were coming down here for matariki. So, you know, I went and talked to them about matariki for like 15 minutes before I even told them why I was there. But, you know, that's how you have to do it, eh? You know, you gotta get them talking first, you know. So after that, usually I'll explain to them then that I'm there to get them to come in for an assessment. And that's another thing, like you have to try and read the people that you're talking to. You don't just, like some of them I can do bro, you know, you need to come in and get your test done now. You know, you can do that informal thing, or other times I explain that Korowai Aroha is trying to find new ways to get more equity for Māori in healthcare. Like, what approach do you use? And you just have to figure that out at the time, you know, with the people you're talking to. Then I tell them that it's free. I lie about how long it's going to take, because, you know, by the time they're there, they don't know I've said 10 minutes when it's actually going to take half an hour. But, you know, so yeah, and then I try and make an appointment for them on the spot. Like, I'll get my phone out and try and make them Make an appointment on the spot, because I know if I leave and I tell them make an appointment and come in, that's not going to happen, eh? So I try and do it on the spot, and even that's, that's not guaranteed. There's so many times I make an appointment and they just don't come in, but usually the first answer is no. And so what I do, it's just a matter of visiting again and again. This can take, sometimes for me it's 6 or 7 times, before they feel comfortable enough to come in. Sometimes they never come in, but you just keep trying. We get guys who even come into the clinic for other reasons, like to pick up prescriptions, or maybe they got some other ailment and they still refuse to do their test. There are a number of reasons for that, not wanting to hear bad news, scared at the sight of blood, not tolerating needles, the list goes on, eh? But what I found that you can actually eventually, if you try hard enough, you can get these guys to do their tests, and this might take a bit more finesse or background knowledge, and I'll just talk about one case in point. There was a guy who came into the clinic, and he was I alerted the team that he was on our list to do a CVRA. We went and approached him and asked him if he'd do it, and he just outright refused. But what I noticed is that he was really edgy and he was quite shaky, and I thought, okay, we'll just leave it at that for a while. I went up and looked at his notes and then saw that he was on the methadone program, eh? So it was like, reading between the lines, he'd come in for his methadone prescription. So I said to the nurse, look, we'll go and see this guy at his house, but give him a couple of hours. And that's what we did, and sure enough, he had no problem giving his blood, doing his assessment, eh? And so that's just about knowing that, he needed his fix, eh? And we just had to wait for him to do that. And then after he had that, there was no problem. So that's kind of an example of, understanding the people you're dealing with, eh? It's just everyone's different, but that's just one example. I think with guys like that too, you don't write people off. So it's so easy to write people off like that, because they're seen as junkies or whatever. But I think from my own experience, I believe that everyone deserves the best healthcare that I can provide, and that's because, like as Kiwi said before, he has, but I have also personally been through probably every system that you can think of in this country, and that's social welfare, health, mental health, justice. I've been through them all, and I know how others pass judgment and how you get treated, and so I make it a point that I never treat other people like that. I treat people as my equal. Okay, so that's engagement. Well, that's my idea on engagement anyway, which is relationships. Equality, well, that's pretty self-explanatory to me. That's just about being non-judgmental, eh? Because I've even learnt that in my own dealings with CVRAs, like going into the forward block, and I'm just thinking, what the hell am I going to, what the hell going to open the door? It's going to be... And there's been like gang members who patched up gang members, and they've been the nicest guys that you'd ever meet, eh? And I just think, man, I've got to stop prejudging, eh? Because you never know. So that soon became obvious to me that I had to stop doing it, and now it's become quite easy. So education. Now I know through my experience with the tāne takituākea program that the Māori men that we have on our cohorts, look, they're just as interested in their health as any other person. However, it must be delivered in a forum and in an environment where they feel comfortable, and preferably delivered to them by Māori. Now, health is usually considered by men to be the domain of women. Health is usually considered by men to be the domain of women. Is that a fair statement? Yeah, that's a fair statement, eh? The woman always looks after the kids when they're sick. But we found that if you get a group of men together and explain to them, and I'll just use cancer as an example because we have the Cancer Society talk on our tāne program. If you explain to them what cancer is and how you get it, what you can do to mitigate the chances of getting it through diet, exercise, whatever, they listen all right. They engage, they ask questions, and they're genuinely, after those sessions, they're more motivated to do something about their health because they realise that their health is in their hands and there's something they can do about it, eh? You don't have to be fatalistic about what happens to you. So I think I'm talking about health literacy, really, So it's just getting it out there, and men are just as interested as women. And that's what we offer to the men on our program, and they take it with both hands. Like we see it all the time. I think I don't have all the answers as far as education. Like I think, as Kevi mentioned before, there's no point trying to talk to teenagers about cancer or diabetes because they're bulletproof. They're just going to laugh at you. So I don't know how you do that. I can just speak from my own experience and on the people that we deal with, and I think that's why we chose them, because they're a bit easier. But I do think health education needs to be taken to the rural areas and to the marae, out to the people, in other words, and maybe that's one way that you can find that healthcare can look more equitable for our people. So just to recap, did the 3 E's: engagement, education, equality, and I think too the ability to remain flexible. There's not any one generic approach that works for everyone, eh? You got to tailor it to the person as much as you can. I'll just briefly go over some of the barriers that make it difficult to get Māori to engage. I think these things are pretty much common sense anyway. They're things like cost, transport, suspicion, fear of being told bad news, those kind of things. So from my perspective, I'll always offer to pick people up and drop them off if they agree to do a health assessment. Look, I know if they owe money to Korowai Aroha and that they haven't got any, what I'll do is I'll talk directly to the CVRA nurse and I'll circumvent the reception so they don't have to go to reception. And so they don't have to go through the whakama of being asked to pay when they've got no money. Now, this might seem to be going behind the back of my employer. However, it does make total financial sense because I think for those of us out there who know, for each person that you're able to get in to come and have their CVRA done, Korowai Aroha and every other health centre is paid by the DHB as an incentive to mitigate long-term expensive hospital care. So, the amount of money that comes from the DHB far outweighs what that person knows for a couple of doctor's consults too. So if I can get them in that way, well, okay, te whai. I think if the problem is that they fear what they're going to hear, then, that can only be done over time with a bit of reassurance and just persuasion, just gentle talk, and that takes time. I'll probably leave it at that actually, because We are actually running way over. But I think I'll just remind everyone that every when you approach anyone, just remind yourself that to treat everyone and every person with compassion. Don't judge people, and just make yourself approachable as possible, which is kind of what I try and do. Seems to work. Kia ora.